Okay, I think we're live now. Okay, so thanks to everybody for joining. Welcome to our event, The Road to COVID Recovery, Weighing Up Cost Benefits and Intergenerational Fairness. So this is an event put on by the Cage Research Centre at the University of Warwick. I'm Mirko Draka, a professor of economics in the Warwick Economics Department and director of Cage. And we put on this event with Andrew Oswald and Thijs van Rens in order to kind of discuss this connection between kind of the economy and public health in terms of COVID policy with respect to COVID-19. The way we're going to run this is that Andrew and Thijs will each speak for about 10 to 15 minutes each, and then we'll be taking questions from the Slido link that you will have got with your registration package. And I'll ask those questions on the behalf of the people posting to the Slido link. I asked kind of Andrew and Thijs whether they wanted long introductions. They're modest people. They don't want long introductions. You can kind of go to their respective websites to kind of look at the full sort of details of their careers. There is an accompanying paper that relates to the work that they're presenting today. That's been posted to the Cage website under the publications tab on the main Cage website. So without any kind of further faffing around, we'll just get straight to it. So I think Andrew's going to speak, and kind of Andrew will kind of directly speak without slides. So I'll hand it over to you, Andrew.
Thank you very much, and it's very kind of you to invite us. I'm giving this talk in the usual conditions. I have a very large dog on my left-hand side that's just pressed its jaw onto my left thigh. The sunshine is coming into this small office. This is 2020. I'm going to talk about the ethics and the science and the potential optimal policy for COVID-19. This is work with Thijs, as was said. 3 years ago, a book was published by an unusual man called John Broome. The book's called Weighing Goods. Broome has the distinction of having been a professor of economics, in his case at the University of Bristol. And then after that, I think initially at St Andrews, a professor of philosophy, and certainly ultimately a professor of moral philosophy at Oxford. And the book is about how you weigh up good options and make optimal choices, particularly for society. I like to think of that in the back of my mind for this very difficult problem of how we deal as a country and a world with coronavirus, because I find it helpful to think of the issue as how do we weigh harms here. Broome's book is about weighing goods, but unfortunately we're in a position where every policy option that we come up with will have rather dark negative aspects to it. But somehow or other we have to work our way through as a country and a world, choosing presumably to minimize in some way all the different harms. I'm going to start with some ethical questions, if I may, then talk about some scientific issues, say one or two things about policy, and particularly about the link between age and COVID risk and how one might link age to the optimal kind of policy design. Thijs will talk about some numbers and I'm sure give his own personal views. I'm going to stick to words and ideas for 5 or 10 minutes. The ethical questions will include, is it morally justifiable to pass huge debts onto our grandchildren and to the unborn, cross-subsidizing from their hospitals and primary schools to us to keep people my kind of age, to be perfectly honest, but also older than me, alive for a few more years? Is that ethically justifiable? That's not an easy question, and reasonable people can disagree on it, but we may have to come back to that. We're about to go, as far as I can tell, into different kinds of so-called tiers instead of something called a general lockdown. And a key issue scientifically and morally then is it morally preferable to lock down whole regions rather than to lock down, I'm using this very emotive language, really restrict the lives of different age groups? Is it really desirable to do that to regions rather than to age groups? Again, that's not an easy ethical issue to deal with. Going on to scientific matters, we know that the key feature of this unpleasant virus is the really remarkable age pattern. In a real sense, the COVID-19 virus discriminates against the old. And just to give anyone who doesn't know the numbers a sense of that, say we take age 40 in this country, in the UK, very sadly, about 300 people, about 300 under the age of 40, have died. And if we look to what I would call the right of that distribution, or in other words, to higher age groups, about 55,000 people, depending on your exact definition, I'm using the ONS numbers, about 55,000 people have died. That's 40 is very roughly the middle of the age that most of us reach, only very roughly, 300 deaths to one side, 55,000 to another. This is the key scientific feature of the virus. And one might think naturally that an optimal policy would be fashioned around that really striking age profile. If we move on to the costs of the pandemic, I'm partly an economist, perhaps mostly an economist. Probably the best estimate at the moment is that the economy is going to take about a £450 billion hit, and that's still going up all the time. We know that new furlough extensions are proposed. Now, it wouldn't be fair to say that the cost of pandemic policy has been £450 billion. Perhaps it's about 350 billion because there would have been some drop in GDP anyway. And just to put that into context, that kind of pandemic policy cost is about £10,000 per worker, averaging across the part-timers and the full-timers, about £10,000 sterling. Although interest rates are very low and that's a big help at the moment, I'm afraid that eventually, I take the view, and most economists would take the view, that £10,000 will have to be repaid. And as an approximation, my age group is not going to repay it. Many unborn citizens will contribute to that. And as I implied before, unfortunately, that's a transfer of resources away from their hospitals in the future to our healthcare and possibly, very possibly my healthcare. So although we can put these numbers as financial amounts, really what we're talking about is transferring happiness, even you could say, or certainly the resources to help different generations from the future to us. And we have to decide in part whether that's justifiable in terms of intergenerational fairness. There are different kinds of policies, of course, and recently 3 papers have tried to weigh up the costs and the benefits. I'm assuming that almost all of us would, in principle, like to weigh up costs and benefits, even though I've not heard that done in any of the speeches made by Boris Johnson and his colleagues in admittedly very difficult conditions. I think we should all admire the way they've shouldered the incredible responsibility. I wouldn't have liked to do that. And regardless of whether I think things have been done correctly or incorrectly on details, I have to admire the leaders who've really had to take that responsibility to decide on something for the country. Now, in doing a cost-benefit analysis, typically we use the so-called NICE approach from the National Institute for Health and Care Excellence. And there's a long-standing procedure for how we decide, is it worthwhile to fund a new drug, for example? What NICE does is it works out the costs of a drug or a medical treatment, and it weighs it up against what's generally the accepted value for the value of life. That sounds tremendously harsh, but there's something called a QALY, which is a quality adjusted life year that NICE and many, many health economists have used for decades. Generally, a QALY, one extra year of life, is valued between £30,000 and £60,000, where it's not always the case that the higher estimate is thought reasonable, but I'm going to stick to 60,000 to give lockdown proponents, one might say, thinking about how strong is the case for lockdown, that in a sense the best chance. Now, if we think we might have saved 300,000 lives through COVID-19 policy, and it's not easy to believe that, as 55,000 people have died, but let's say, to fix ideas, that we've saved 300,000 lives. If we say that on average every life saved gives another 10 years of life, again, not a terribly plausible assumption, I'm afraid, because the virus discriminates against the old so much. But we end up concluding that the value to society on standardized criteria, weighing things up, I know this is hard-hearted to any non-economist, the value would be about 180 billion. And that is if we have saved 300,000 lives, which I have to admit many commentators think is implausibly high. One can immediately get a sense of how difficult it is with standard ways of thinking, weighing up the costs and the benefits, even before we get to issues of intergenerational fairness or the tremendously bad mental health effect on the young that we know now from the data, or the very sad effect of the unemployment, which has been much harsher on the young. That intuitively, this high cost of lockdown policy, when valued on nice criteria, this is what unfortunately lies behind the potential ethical and economic difficulties. Is it plausible that as many as 300,000 people have been saved? Probably that's rather on the upper end, but you could take large numbers. If you read the Neil Ferguson paper, the very good Imperial College epidemiology paper, which is still on the web and I greatly recommend to everyone, he puts the very upper end number at 500,000 in our country, but that's based on the assumption that nobody reacts to anything to do with the pandemic, and very few people think that that would be a reasonable estimate of what would happen if we didn't. The benefits of lockdown are, of course, the lives saved and the saved illness. We have to bear in mind so-called long COVID, and that might be relevant. The costs include financial costs, mental health toll, and that's hit everyone, but particularly the young. Of course, a lot of cancelled cancer operations and so on, loss of social meetings and happiness. We know that social events bring humans a great deal of happiness, and you probably don't need my kinds of teams equations to know that. And then there's the issue of how reasonable is it to push the debt onto much younger people than ourselves. I'll draw to a close very soon, if I may. The three studies that I would recommend to anyone, the cost-benefit studies, they all conclude that lockdowns are not desirable. They all conclude that costs outweigh the benefits, I'm afraid. Those are by Robert Rowthorne and colleagues at Cambridge, by Sanjay Reddy, who published in the BMJ, and I'm afraid his American institution goes out of my head for a second, and also David Miles and his colleagues at Imperial College London. Intuitively, it's because it sounds terribly hard-hearted, but the people who are being saved do not have nearly as many years to live as the young people, much younger than me, who will come after them. I'll stop very shortly now, just remind you that this is inevitably an extremely difficult and hugely emotive topic. Reasonable people are allowed different ethical views, it seems to me, and I'm quite happy to tell you my particular take on it. But for myself, I don't think that the ethical issues were debated very clearly at the outset. And as we go forward and we plan for future potential pandemics, perhaps we need to bring these issues right to the front of our minds. I'm going to draw to a close there because I think Zoom meetings are best as discussion fora, but I know that Thijs will go through some numbers and give his own opinions.
Okay, thanks very much, Andrew. I'll hand over to Thijs then. Thijs, do you want to take over and share your screen?
Yes, absolutely. So thank you for inviting me here, and thank you, Andrew, for that great introduction. Let me show my slides. Yes. So as Andrew described, cost-benefit analysis of a blanket lockdown doesn't seem to work out very favorably. I'll get back to that in a minute, but what Andrew has been thinking about for quite a while now, and myself more recently as well, is whether we could improve on that cost-benefit analysis by conditioning the various restrictions we impose on people on characteristics, and in particular age seems to be a leading candidate. So as Andrew anticipated, this has been a very emotional debate. So here are two quotes from people who are vehemently against conditioning lockdown restrictions on age, or releasing of lockdown restrictions on age. First is from Simon Stevens, who is the chief executive of NHS England, who says that the idea that you could separate a fifth of the population, so older people, is implausible, and it would be age-based apartheid. So the second part of that statement in particular seems more emotional than rational, perhaps. But the rational argument that is in there seems to be that it is implausible that we can do this. And the second quote is a bit clearer, I suppose, on the reason for that. This is from one of the two letters that were circulated a month ago, more or less, for and against general lockdown restrictions. This is the one that is against releasing, is against conditioning the lockdown on age. And the argument is that it would be practically impossible to do this, in particular because people live in multi-generational households. So what I want to talk about mostly is the question, how common are such intergenerational households, and therefore how impossible is it to condition restrictions like lockdown on age and protect. Here's our first graph. The pie here is the number of people that you might consider vulnerable to COVID-19, which are older people. And here we define old as over 65 years old. The slice in the pie here is the fraction of those people over 65 years old who live in a multi-generational household, which here we have defined as who live in the same household as a worker who is at most 35 years old. And the conclusion that is hopefully obvious from this simple graph is that that is a very small fraction of older people who would be exposed to intra-household transmission if we were to release young workers from lockdown restrictions. In fact, the data tell a stronger story. So you can vary the definition of old and young. Let me start by varying what young means. If you define young as under 25, then the fraction is obviously even tinier. So you could pretty much safely release workers under 25 years old. But what is most striking about this second pie chart, in my opinion, is that if you were to release all workers of any age, including workers that are close to retirement, the number of over 65-year-olds that would then be exposed to intra-household transmission is still fairly limited. And almost 85% of people over 65 do not share a household with anybody who is still in the labor force, so with anybody who would go back to work if we were to lift all restrictions that are work-related and are currently in place in a lockdown. If you vary the definition of old, the picture changes very little. So this is the number of people over 75 and people over 85. You see that as you go older, people are slightly likelier to move in with their children. Presumably that's the reason why they're slightly likelier to live in an intergenerational household. But the fractions are still small, and the vast majority of older people seem to live by themselves in the UK. So that then brings us to the idea that Andrew has been thinking about for a while, which is that we might condition the release from a lockdown, for example, on age. And the first thing I wanted to point out is that we are, of course, already conditioning policy on things. And in particular, now that a vaccine seems to be on the horizon, it seems to me that surely we are going to condition restrictions and social distancing rules on vaccination status. And I was happy to discover 2 days ago that I'm not the only one thinking so. This is a quote from Tom Solomon, who is director of the National Institute for Health Research, who talks about how we might restrict people who choose not to get vaccinated from going to public places, for example, to pubs, clubs, football stadiums. Now, of course, conditioning a release on vaccination status is not quite the same as conditioning it on age. Whether you get vaccinated or not is a choice, and whether your age is not. And on top of that, age is a protected characteristic. So I think there is some truth to the idea that we need to be careful advocating this type of policies. However, it's the disease that is discriminating against age here. And making policy as if that were not the case, as if there were a level playing field, seems almost foolhardy, because there clearly isn't such a level playing field. So we believe that an easily observable characteristic like age is very likely to improve on the cost-benefit analysis with respect to a blanket lockdown. I showed you one way of looking at that, which is to think of the percentage or the fraction of older and vulnerable people who would be exposed to transmission or infection with the virus in this way. Another way to look at that is to think of the fraction of workers that, if they were released, would then endanger their household members. So here is a pie chart which looks similar but is completely different from the previous ones. Now the total area of the pie is our young workers, where I define young workers as before as workers up to 35 years old. And the slice here is the fraction of those young workers who live in a household that also includes an older person, which is here defined as over 65 years old. And the picture you get is very similar. The vast majority of workers do not share, of young workers, do not share a household with an older, vulnerable person. And in fact, the picture is more striking, if you like, was on this second pie chart of the second type. The total area of the pie is now all workers of any age. And even if you were to release the entire UK labour force from lockdown, only 88.2% of these workers share a household with an older person. As before, you can explore how that varies with your choices about what old and young means. So the percentage of workers who live with a with a person over 75 or even over 85 gets, of course, smaller and smaller. Now, what I take away from this graph that we couldn't see before is not only that the picture is in some sense very similar and intergenerational households do not seem very common in the UK, but it's also that we might be able to improve on a policy that is simply based on the age of the worker, for example, by conditioning release of lockdown on the age composition of the household that a worker lives in. And I believe this has advantages. Most important advantage being that even though these percentages of old people who are exposed by releasing younger workers are small as a percentage of the overall number of older people, the UK population is fairly old, and as a result, these small fractions correspond to fairly large numbers of people. So there's over 12 million people over 65 years old in the UK. So the fraction that would be exposed by releasing all workers amounts to about 200, let me look up these numbers, but I think it's about 200 million. Sorry, 500,000 people over 65 years old would be exposed if we were to release the entire labor force. 200,000 people over 75 and 90,000 people over 85. Now, these are small percentages, but large numbers of people. And one might argue that a policy should at least aim to protect these people, even though that will, of course, depend on how well the policy is adhered to. Now, what I've been thinking about is if you were to condition release on the age of your household members, then you are, in fact, protecting these people, and you can still release 92% of all workers. Now, the big advantage, in my view, as an economist, is that if you were to release 92% of the labor force, the funding that is now being used for the furlough scheme and other types of income support will, of course, go a lot further. If you only have to pay for the remaining 8% of workers who cannot go back to work, such programs can be a lot more generous. That's the main point I wanted to get across, but let me briefly get back to one of the two quotes that I showed earlier, because there's a slight issue here that I wanted to draw your attention to. This is again from the letter from Professor Grinalg, who talks about how it is especially disadvantaged groups who live in multi-generational households and who are therefore would be exposed to transmission within the household if younger workers or all workers were to be released. We looked at that in the data, and we found interesting differences, in particular for the Black and Asian and other ethnic minority subsample. So here is the BAME labor force, if you like. Just like for the overall sample, really, the vast majority of BAME workers do not live in a household with an older person. So this in some sense is encouraging. The picture looks very similar for this subsample. However, there is a big difference. If we go back to the first set of graphs and we plot the number of older people in the BAME subsample who would be exposed if we were to release workers from the lockdown, the picture changes quite dramatically. So there is a very large fraction of older BAME people who do live in an intergenerational household. Now, in case you are wondering what reconciles this graph, which looks just like the graph for the full sample or for the white subsample, with this one, which looks very different, it's that the age distribution of the BAME subsample is very different. BAME citizens are much younger. So there are more BAME workers relatively, and there are less BAME older people. So there's no contradiction here. But what it does say is that there is an inequality here. If you were to release all workers, you would disproportionately expose older BAME people to transmission or infection with COVID-19 within their household. And I think of this as the second reason why we should fine-tune policies like this. And if we were to condition release on the age of your household members, then that would take away that inequality. As a side note, it seems plausible, or it seems at least possible, that this chart may explain in part why prevalence of the disease is so much higher among the BAME population than it is among whites. That's pretty much what I wanted to show in terms of numbers. Let me wrap up with a few conclusions. So as Andrew has argued, lockdowns are a very blunt instrument. I personally think that they may very well be needed in emergencies. And I personally do not feel it was a mistake to go into lockdown in March. But it's also true, and it's hard to deny, that in the longer run, if we were to use lockdowns frequently, the costs do seem to outweigh the benefits by most conventional ways of calculating cost-benefit analysis. You can optimize on those costs and benefits by conditioning the release, and my prediction is that we will certainly do so based on vaccination status, and our proposal would be that we should at least consider conditioning release on other well-documented and easily observable risk factors like age. And then third, I think this type of conditional release could be fine-tuned, and I think it would be preferable to condition on the age of the household rather than the age of the workers themselves, because this would at least aim, if the policy were adhered to protect all vulnerable people, and it would also address a striking inequality in the risk of COVID-19, in this case between the BAME and white subpopulations. That's what I had to say. Let me unshare this, and Mirka will take over for questions.
Okay, so thanks a lot, Thijs. So we started to get a lot of questions on the Slido. I noticed, like, once you started showing the pie graphs, people started to shoot off questions. So there's a behavioral economics paper about pie graphs to be written there. So what I'll do is, there's a couple of questions that I'll start with that I'll kind of group together because I think they cover the same sort of theme, right? Okay, so it's these two questions. Thijs, you mentioned the ones who share a house, but what about dependents? People who don't live with their old parents but need to visit them often. And then there's someone else made this point, even if they may not live with older people, they may be living close and visiting often, right? So I think this relates to the way I see this is that you're kind of looking at this data about essentially cohabitation, right? But there's going to be kind of leakage from that kind of cohabitation channel in the form of visits. I think two forms of kind of leakage or ways that the virus can reach people is from kind of visits, so just inter-household visits. And then there's this issue of once you release younger people out into the population, you make the virus more prevalent, right? Such that if an older person goes to visit a supermarket or is just going about minimal activities day to day, they're going to be more exposed to the virus, right? So how do you think about this kind of leakage component of between household visits and virus prevalence?
So I think both are very good points. The second point more than the first, I would say. So yes, there will be leakage. There will be people who don't obey the rules in whatever policy you have in place, but that's not specific to an age-based policy. So currently there is strong restrictions in place on people visiting each other across households, and yet it happens all the time. I'm aware of that. That wouldn't be any different if you were to allow some people to do that and others not to do that. So I do think it's potentially a problem. Maybe Andrew has something more interesting to say, because this seems mostly a behavioral science issue almost. How do you get people to take responsibility for their actions? But I don't see it as being crucial to the question that we've been thinking about, is whether or not you should condition these policies on age or other things. The second point, which now temporarily escapes me.
That was the prevalence of the virus.
Right? Yes, absolutely. So that is a very good point, and that's clearly going to be true. The more people you release, the more risky it becomes for the people that are shielding, that are vulnerable to disease. I think that's absolutely true. However, and I'm not saying that we should release everybody to the maximum extent possible necessarily. But I think what we're saying is that it seems that the extreme policy that is currently being used to not release anyone at all, even people with very low risk of getting infected, and therefore also very low risk of transmitting the disease to others, that cannot be optimal. And we're not saying let's release the maximum possible number of people necessarily, but let's think about who we might release and how might that affect the costs as well as the benefits.
Okay, so unless you've got something, I've got a question here that's kind of more in terms of Andrew's expertise. Okay, so someone asks about the long-term costs of COVID, e.g. mental health and long COVID could be very large. How should policymakers take this into account when planning for recovery? We've got another question out there about mental health. I guess the question here is like, Andrew, what do we know so far about the impact of the COVID crisis, especially the lockdown on mental health, right? And in particular, how much of that do we think is transitory and how much do we think may be persistent? And how are we valuing that in a cost-benefit framework?
The three cost-benefit studies I've talked about, as far as I could see, don't put any explicit value on the mental health effects per se, or on the fact that the mental health hit, if I can put it in that slightly unpleasant way, has been much larger on young people. We know that, consistent with intuition, all the survey data suggests that there was a huge effect on mental well-being among UK citizens immediately around the time of lockdown. In fact, it started before, of course, because people were aware we had a crisis in this country and in the world. Then there was some considerable psychological recovery. Where we currently are, the data, of course, aren't in yet, but personally, I'm very concerned about this, a much harsher effect on the young. And that's almost certainly because, of course, in general, they're not married in nice homes. and they're much more vulnerable to unemployment. Generally, young people have double the unemployment rate of all adults. That's a rule of thumb that works across Europe. And their prospects, of course, are bleak relative to my generation's prospects, certainly very much in financial terms. On long COVID, so-called, we're learning all the time. One estimate is that the same proportion of people will get long COVID as die. So you could think of there as sort of double effect. Now, presumably in evaluating the costs of that and thinking about an equivalent QALY calculation, we wouldn't value long COVID at anything like the cost of a fatality, but we should put some weight on it, and I don't think we know enough yet. If long COVID disappears after a year, I assume we shouldn't put too large a weight on that, even though it must be truly horrible to have those symptoms. Long COVID is a problem for all policies, and the absolutely key thing I'd like to leave anyone interested with is that we are here weighing harms. We are weighing harms, and every policy has some horrible aspect. The more we shut down society, the more costs we impose psychologically on people, and the more we push enormous debt onto the young and the unborn.
Okay, so thanks for that, Andrew. I've got one question here that I think ties to what you just said, right? So it's someone asks, the fundamental cost of age-dependent lockdowns would be the damage to the fabric of society and trust in the social contract. How can we internalize this as a cost? I sort of interpret this as a question about having kind of older and vulnerable groups who are being shielded, right? And you talk about intergenerational fairness and kind of how costs are borne by kind of younger generations. But how do we think, as this person says, internalize this cost of concentrating the costs of COVID policy on in terms of this group of shielded, older and more vulnerable individuals?
Would you like me to answer that, or would Thijs prefer to go first? Shall I have a go? There's something in the recent literature that has been called the fair innings argument when it comes to thinking about COVID, and of course it does what the name implies, that this is a crisis for everyone, and that there's a natural fairness argument for remembering that people who are vulnerable over 65, and that's by far and away the dominant group, they've had a much longer life, clearly, than the young people. They have pensions. In general, they don't actually have to go out to work in nearly the sense that the younger individuals have. These are always going to be difficult moral choices, I'm afraid, and reasonable people can take opposing views. But I'm afraid, personally, I do feel uncomfortable about the young and the unborn transferring huge amounts of resources to me.
Okay, I mean, if you want to say something, Thijs, I can kind of give you that opportunity, but I've also got a question here that's sort of more to your
I'll take 15 seconds just to say that I'm sure that this type of policy will put pressures on the social contract, but so does, of course, the extreme age profile that the disease brings with it already. And so we are currently asking enormous parts of the population to make great sacrifices for smaller parts of the population. And whereas I do believe that policy should aim to protect everybody, it's not always possible, and sometimes there are trade-offs. And that's what Andrew has been saying. At that point, we're gonna have to do something that is not pleasant. We have to weigh the harms.
Okay, all right. So I've got another question here that's kind of more directly associated with what you were speaking about in the pie charts, Thijs. Okay, so Thijs, does the Bain conclusion hold regardless of deprivation, i.e. is it an economic necessity to live in intergenerational households, or is it cultural? I guess that's kind of pointing towards the sub-ethnic group and cultural heterogeneity of that Bain result, and how it relates to kind of income. So what do we know about that?
I haven't looked at social economic status or household income. It is possible to some extent to do that. You don't really observe household income in the data, but you observe proxies of that are not bad. So that's something I can look at. And it would make sense that at least some of this effect, some of the difference between BAME and white is due to different economic situation. We did look at subgroups within BAME, and somewhat surprisingly, we didn't find any differences between Blacks, Asians, and other minorities. They in this particular sense, they look similar and different from whites.
Okay, great. So one question, well, that I've got, so I'm sorting through some of the questions, and as I sort through is, okay, so we've, in the last couple of weeks, we've had this news about the vaccine come out, right? So how should we think about the scope for age-dependent policies and what we do over the next 3 to 6 months in the context of the availability of a vaccine, right? So one way to interpret the overall argument that you've made is that it's essentially an argument for a very rapid return to normal, right? In terms of how you're looking at risks and how you're looking at the trade-off. Is that a fair way to characterize the contribution of this work to this kind of vaccine period policy? Either of you.
I would say that if the country is reluctant to make firm lockdown or non-lockdown rules, whether in an aggregate sense or an age-dependent sense, the country could simply be given a huge amount of information and advice about who is at risk. I imagine that one day historians will look back on this and be surprised, to put it in a gentle way, that there was very little information given to people about the age risk profile for months and months, even though it was clear from late January from the Chinese data that chronological age was by far and away the key risk. So that's one thing that comes into my mind. I don't know whether Thijs would like to chip in.
I'm actually not sure I agree with the statement that what we're advocating is a very quick return to normalcy. I think what we're arguing is that people are different and the disease treats people differently. And it seems extremely unlikely that a policy that treats everybody the same is the optimal policy. It seems much more likely that a policy that takes into account that this is not a level playing field and that people are affected in different ways. So old people are clearly much more affected by the disease itself. Young people are equally clearly much more affected by the restrictions on the economy that are a response to this disease. And it seems that there should be room for improvement in the policy if you take that difference into account.
Okay, good. All right, so we've got Francis Cancross has got the chair of our advisor board, no less. Okay, but I chose this question before I noticed her name there. Okay, so she's got this question of why is government so reluctant to accept policies based on age? Andrew's been talking about this for months. The way I see this question, it's about the political economy of policy to deal with COVID-19 and lockdown stuff and lockdown policies, right? And so, is there something about the political economy of policy making that has kind of prevented an adoption of an age-dependent policy, right? Either of you, if you want to discuss that point.
Why doesn't Thijs go first on that?
I was gonna have you answer because I think you have a very good answer to this. But my personal opinion, which is I should preface, is not an expert opinion. I'm not an expert on political economy, let alone political economy of health policy making. But my personal opinion is that it has something to do with the fact that policy has been dictated by one particular discipline, doctors. And doctors are trained to always protect everybody's life and health. And that's great in a normal situation. But we're currently in a situation where that is not possible. And I'm not sure doctors are imminently in the right position or have the right training to make the type of trade-offs that are now having to be made. And I hope Andrew will continue to say that one thing that seems interesting is that how little economists have been involved in this type of decisions.
It certainly is the case that, at least from the outside, it appears that economics has had very little to do with it. It's still true as an approximation that there is no economist on SAGE, and there wasn't at the start. So it's not surprising that sheer, what we might call medical or public health opinion carried the dominant weight. If it had only been economists on SAGE, probably there would have been too much emphasis on financial objectives. It has been an unfortunate thing that there's been a lot of criticism by one kind of scientist of another, and we, as a group of researchers across disciplines, we haven't worked together. On the age thing, well, there is a strong ethic in our country and across the Western world that it's wrong to discriminate in any sense on age. An economist might say because that's an exogenously fixed characteristic and it's not fair to judge on exogenously fixed characteristics, but whatever one thinks. And I've been on a number of radio shows with the Baroness Altman, the spokesperson for Age UK. I think she is currently, and she feels extremely strongly that it would be morally wrong to tie anything to age, even though it has been pointed out to her by those interviewing us that the virus doesn't have her concern and does heavily discriminate. And another political economy theory, I can't comment on it empirically, is that the current government is heavily supported by old people and rather less supported by young people. But I'm afraid I have no way of knowing whether that's in Mr. Johnson's mind at all.
Okay, so those are interesting answers. To follow up on that, right? So I guess are either of you aware of, so Gus O'Donnell had a lecture, kind of online lecture for the IFS Institute of Fiscal Studies, where essentially he was kind of arguing for an approach of following the sciences, the plural of science. And kind of what Gus O'Donnell was effectively suggesting there was you have kind of an extra meta committee above SAGE, right? So he was noting this point about the disciplinary makeup of SAGE, and he was kind of noting also the point about the necessity and sort of the globality of policy making to make these kind of social, economic, and health trade-offs, right? So his suggestion was essentially to have a meta committee that specifically has the remit of dealing with the trade-offs, of like calculating these trade-offs, right? And recognizing the disciplinary expertise that's provided by SAGE as something rooted in health. Is that the sort of, so my theory in the political economy is sort of consistent broadly with kind of what you guys have argued, but I also see a big issue here with the sort of the economics of information processing and aggregation, right? Of, you've got policymakers there, particularly politicians who've got, let's call it an imperfect understanding of a lot of these issues, right? So they're by necessity usually generalists, and they need some sort of tool to kind of process this information, reconcile the information. So is that the kind of framework that you would see as required, as like some meta committee or some extended process for decision making?
In a way, presumably that was the objective of setting up SAGE in the first place. And perhaps remarkably, Trish Greenhalgh, who signed the attacking letter against the Gupta letter, I was one of the signatories to the Gupta letter. Greenhalgh said it's essential that we have multidisciplinary thinking on this, even though it was really only epidemiologists and public health people who signed her letter. So surely we could all agree that we need a mixture of talents and experience. And I'm hoping everyone would agree that we need a cost-benefit analysis of some kind. Beyond that, individuals have different ethical views, and they're allowed to put more weight or less weight as individuals on intergenerational unfairness as they perceive it and so on. But some of the cost-benefit calculations should in principle be positive rather than normative, and there should be a big interdisciplinary team who could provide those estimates. Then some final moral choices have to be made. And unfortunately, the makeup of SAGE, I'm afraid, didn't contribute to that broad view in my own judgment.
Okay, Thijs, do you want to add anything there? I've got a question for you coming up.
I agree with Andrew, and I think Gus O'Donnell is in a great position to make proposals here about how that can be implemented. His proposal would address, I think, the problem that you discussed.
Yes, I recommend people have a look at that lecture on the IFS website. It's a very kind of cool-headed and calm contribution. Okay, so Thijs, the question here is that they say, I agree that a less complex policy might yield suboptimal results, but complexity comes at a cost. That is why models are usually simple. Why not policy? I think that's a great point, right? So, us as academics, we adore complexity, right? We cannot get through a conversation at the corner shop without talking about exogeneity of quasi-experiments or calibration, right? Or at least the people I know. So what do you think about this? It's sort of, I see kind of less complexity. It's almost like a satisficing solution, Thijs. So how do you think about this?
I'm not sure Andrew and I are entirely on one line here, but I personally am really glad we went into lockdown in March, because it's a policy that we had very good reason to believe was going to be effective. It had huge costs, but it also had huge benefits. And one of the main benefits to go into lockdown at the time was that we were relatively sure this was going to stop the spread of the disease, which was going to give us time to develop a vaccine, to buy more PPE, to think about how we were going to deal with this thing next. But I think that a lot of these benefits are no longer present for the second lockdown, because presumably we had time to get our affairs in order, and yet we are resorting to the same very blunt tool. So I completely agree that that complex policies have disadvantages, and one main disadvantage I see in the case of COVID-19 restrictions is that the more complicated the rules are, the less likely people are to obey the rules, to follow the rules, maybe because they don't understand them, or maybe because they can't be bothered because it seems so complicated. However, and I did think about this, conditioning a policy on age is really not all that complicated. And keep in mind that this is something that we do routinely. It's very easy to prove your age. Everybody knows their age. There's not going to be any ambiguity. And I would argue even conditioning on the age of your household members is not particularly difficult. Depends a bit which way you go. If you provide generous furlough support for workers who live with an older relative, then the burden of proof is on them to show that they do in fact live with an older relative or older household member. And that's easy enough to prove. We're very used to proving where we live. We're very used to proving our age. So it should be very easy to prove that you live with your grandmother in the same address and that she is 85 years old. I really don't think as far as national government policy goes, this doesn't strike me as particularly complicated. So yes, I'm sure there is a trade-off, but in my view, we are very far on the blunt side of that trade-off.
Andrew, do you want to add anything there?
Only just that, of course, it's a very sensible point that simple policy design is good. However, I don't see that conditioning on age, if I can put it in that rather jargonistic way, or fashioning a policy around age, I don't see that's any more complicated than doing so across regions, for example, which is apparently what we're about to do anyway.
Okay. All right. So kind of following up on this, right? So, and it sort of links to some of the debate that we've been having, right? Is, okay, what, in terms of this area of suboptimal policy, what role do you think there is for the precautionary principle, right? So I think there's a strong argument to say that, based on the information that we had in March this year, that we had to exercise the precautionary principle. So at that time, it looked like the fatality rate for this disease could be upwards of 1%, right? And so, following the precautionary principle of this potential for an extreme outcome in terms of lots of deaths, then we needed to implement this full incredible lockdown society, right? And so that's fundamentally about a lack of information about the disease and how the disease works, right? Over time, we've accumulated more information about the disease. But as I was kind of looking at the analysis or the discussion of the second lockdown, it struck me that there's still, how much do we still not know about this disease? And to what extent is there still the possibility of this extreme right tail outcome, right? So in the last couple of days, I was looking at some of the data. The excess death rate in the last couple of weeks looks like it might be hitting 15 to 20%. Right, and over those couple of weeks. So this is still kind of a very, very deadly disease, and there is still the potential there of this right tail outcome, right? So I think, probably the disease is, the current evolution of the disease and deaths has plateaued, right? We've reached the peak of the second wave. But knowing how this stuff spreads over a network, there's still a possibility of this extreme outcome, particularly in specific regions where there may be some risk of health services being overrun, right? So how do you think, in terms of analysing policy and designing policy, we should still think about the precautionary principle and this possibility of this right tail outcome?
I like the precautionary principle, and you put it very well, if I may say so, Mariko. It seems to me the precautionary principle favours age-based policy, and did so since late February. The age risk profile today is exactly what I saw in the Chinese data in around early February, exactly the same. And I think if we'd followed the precautionary principle, looking at the equation of risk, we would have saved many lives, in my opinion. Of course, there would have been much complaining about older people being restricted, but I don't think the precautionary principle, which I believe to be a good one, actually favours general lockdowns.
Is there anything to add there?
Well, I think it makes a lot of sense to act with precaution. And if it were up to me, I wouldn't start by releasing the entire labor force, even not the part of the labor force that doesn't live with an over 65-year-old. But why not start by releasing workers under 25 years old who don't have an older relative in the household? See what happens. Interestingly, and Andrew has mentioned it several times now, the segmentation or segregation by geography that we are doing now is almost surely not very effective. So we did learn something since March, and one of the things we learned is that you can't really do lockdowns geographically because people move. So it doesn't seem precautious to insist to keep doing that. It seems a little bit foolhardy, really.
Okay, good. I think we're coming up to the end of an hour. I think an hour on Zoom is like all we should take. Someone has asked a question about people have blamed the Eat Out to Help Out policy in August and September for boosting, for its role in the second wave. There is actually a CAGE working paper by kind of Timo Fetzer which discusses this, right? What do you think about this idea? Like, we think we've got a colleague who's written a really interesting paper about this, so you can kind of go and have a look at that. So I think we'll leave it there. Any last words, Andrew and Thijs?
Oh, thank you for hosting this event. I'm sorry we couldn't speak, as it were, literally face to face with all the people who were kind enough to join.
Okay, great. All right, so thanks a lot to kind of both of you, Thijs and Andrew, for a really interesting discussion. I think people keep an eye out for CAGE's email newsletters and like kind of other information about events that we'll surely be holding in the near future. Just yesterday, Timo Fetzer released another paper on the effectiveness of the test and trace system, exploiting, to use the jargon term, the variation that was created by the kind of Excel error. So have a look at that paper on the website. And a general thank you